Monkeypox, now a global health emergency. The World Health Organization making that declaration. This is the highest level alert for a disease. Monkeypox is now spread to more than 70 countries around the world. And this morning, President Biden continuing his recovery from COVID-19. Now, his doctors say he is probably infected with the highly contagious Omicron strain BA.5. President's doctors say that the president has a sore throat, runny nose, coughing, and body aches. He is also taking the antiviral drug Paxlovid. More on this now. We want to turn back to our expert on all things COVID and other infectious diseases. Dr. Jeffrey Gold is the chancellor of the University of Nebraska Medical Center. He's kind enough to join us, as always, this morning. Dr. Gold, when we're talking about the president here specifically, what should we pay attention to of a man of his age, you know, given the fact that we still do know people who are still dealing with this, obviously, because of this rise in outbreaks now with this Omicron variant?
Sure. So, we've been seeing just a continual rise over the last several weeks. We never really got down to a baseline level, hovering around 100,000 cases per day in the United States. But over the last several weeks, and particularly over the last 10 days, that number has gone up quite a bit. And it's now up to about 15 to 18 to almost 20% increase, in a running average. And, the president, traveling as much as he does, and with the incredibly high transmission rate of this BA.5 subtype of Omicron, it's not surprising. I mean, I have any number of friends and colleagues that I work with, all vaccinated, all boosted, all taking reasonable precautions, and still come down with a case of COVID-19. So we're seeing it, and I'm sure others in our audience are seeing it just as much as well.
You know, the White House point man on COVID, Dr. Ashish Shah, said this week flatly, we're going to be dealing with COVID-19 the rest of our lives. But in the president's case in particular, to use that as an example, does this show us the difference of somebody of his age dealing with COVID when he's fully vaccinated and boosted versus somebody who's not?
Well, we know, Tom, that as you get older, your immune system begins to wear down a bit, which is why the vaccines and the boosters have been so important to get this aspect of the population vaccinated and boosted. And certainly President Biden falls into that category. It's just historic that the very young and the very old tend, for many reasons, to be the most vulnerable to different types of diseases as well. And this is just another example of it. Fortunately, the good news is these oral antiviral agents, in his case, the Paxlovid, is extremely effective in preventing severe illness. And it sounds like it's working just fine for him.
Dr. Gold, a Maryland-based vaccine company, NOVAVAX, apparently is ready to proceed now with its new vaccine. And some people are calling this a game changer because of the fact that this vaccine is inherently different in the way it's made. What can you tell us about NOVAVAX's vaccine, and why is it different, and possibly a way to get more people to get vaccinated?
So I'm quite excited about it as well, Tom, and the reason being it's made very differently. Both the Pfizer and the Moderna vaccines are mRNA vaccines. That is to say, they teach our cells how to make proteins to which our immune system responds. The NOVAVAX product is quite different in that it is the protein. It's a very conventional type of vaccine that we've had, and our children have had, and our grandchildren have had for years and years and years. And so because it's more conventional in the way it's made, it may have a larger appeal to some individuals who have been vaccine hesitant. And I'm pretty optimistic about that, frankly, and I hope that we can share that fact and communicate it widely and continue to encourage vaccination, because that's going to be the only way we're going to prevent a major surge as the weather starts to get colder when we get back to school.
Dr. Gold, one of the things we have now that we didn't have when this all started was tools and vaccines. But with these new variants, especially like the one that's hit the president, when can we expect to see new vaccines that are variant specific?
Well, a lot of the large manufacturers, specifically Pfizer and Moderna, but also NOVAVAX and others, are manufacturing test doses and running clinical trials of vaccines that are very specific to the Omicron variants. There was an announcement in late June from both Moderna and from Pfizer of a vaccine product that was built around the BA.1 subtype of Omicron, and now there are others that are being built around the BA.5 subtype of Omicron. So when that all will be submitted to the Food and Drug Administration and the ACIP, but more importantly, when it can be scaled in manufacturing, shipped, and get into our pharmacies and clinics, that's really going to determine when we're going to be able to enhance that immunity.
He is Dr. Jeffrey Gold from the University of Nebraska Medical Center. It's our pleasure, as always, to speak with you, Dr. Gold. We hope you have a good Sunday.
Thank you.